My name is Jane Canale and I am the Associate Executive for Human Resources and Support Services. Schenectady ARC offers a wide range of nursing services to the folks that we support in our residential department to provide case management type nursing services. Our clinic nurses support our doctor and our other clinicians, full-time psychiatric support nurse. And in our day programs, we have nurses who provide medical support to the individuals attending the program. And we even have a full-time nurse trainer.
So my name is Allison. I'm a nurse here. I'm a community living nurse. Me and one other nurse share about 24 people who live out in the community. They have their own independent apartments. So we split that, so I have about 12 on that caseload, and I also have a house of 8 individuals. It's a struggle to get them to their appointments, and I think just being compliant with things in general, like their medications, keeping up with lab work and things like that. We offer it to them, we encourage it, but ultimately if they say no or don't go, we just document it. When I first started, there was an individual, and I started scheduling some appointments for him, and people who had worked here for a long time kept telling me, oh, he's not compliant, he doesn't go to appointments, kind of the attitude of why bother, so I took that as a challenge, and I really worked to build the nurse-patient, so to speak, relationship with him. He began to trust me, he would come to me for things medical and not medical, and I'd help direct him to, get things that he needs and resources, and ultimately after a year, looking back at the previous 6 months, he attended over 33 medical appointments. I had gotten him to do multiple diagnostic testing that people have been trying for years to do, and he was compliant with his medication. His diabetes became under control. His A1C level was great for the first time in years. So it was, to me, that was probably my biggest success story. I realized that I love the field. This field is so different from a lot of other nursing fields. You might in the hospital specialize on a cardiac floor or a GI floor, and you become really familiar with that particular discipline. However, in this field, we're long-term care, but we're caring for people their entire lifespan. There's people who've been here for at least 30 years, and we basically case manage their care from day one that they're with us until they're either move on. The typical long hours. Another good thing about the job is there's a ton of flexibility. We're able to kind of come and go. We have to do med pours at night sometimes, so we might not be able to come in the morning. Especially if you have kids, you're trying to go back to school, you're able to live life. We're case management nurses first as residential nurses, but we also are teachers. We have to do med pours with staff. We have to, someone be their supervisor in that role, although we don't supervise anyone directly, but we do oversee the medication administration process, as well as triaging. We're on call. The on-call system here works really well, I think. And I think our team of nurses in general, we have a good group. It's a small, 9 people, and we all really work together to make everybody's jobs, run smooth. I just feel that team atmosphere here, and I feel like that's a big part of, what I like here at ARC.
Our diverse team of nurses make a huge difference in the daily lives of the individuals that we support, keeping them happy and healthy here at Schenectady ARC. Thank you to all the Schenectady ARC nurses. You make a huge difference here at Schenectady ARC.